UBC, inspiring Uganda.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
My name is Dr. Odongo Olwedo. I'm the Senior Executive Consultant of Yumbe Regional Referral Hospital. Yumbe Regional Referral Hospital is a new regional referral hospital in West Nile. The other regional referral hospital is Arua Regional Referral Hospital. This hospital was opened on the 1st of July 2021. It was inaugurated by His Excellency the President of the Republic of Uganda, General Yoweri Kaguta Museveni, on the 1st of January 2021. Ever since this hospital was opened, it served the district of Koboko, Yumbe, Obongi, Moyo, and Ajumani. It serves a population of about 2.4 million people. Of this, we have about 635,000 people. Of these are refugees, and they're refugees from the Republic of South Sudan and the Democratic Republic of Congo. We also have refugees who walk in and out through the porous borders, and they come for services in this hospital. Ever since this hospital opened, the services have expanded from the outpatients department to the various specialties. We now have services of obstetrics and gynecology, surgery, medicine, pediatrics, and child health. We also have other services which have come in, which is ophthalmology, as well as orthopedic surgery. There are also operations in other subspecialties where we have the orthopedics, we have occupational therapy, as well as mental health and the other services we offer for investigations like radiology, like the lab, which we offer to our patients. This hospital, ever since it opened, we had challenges of staff. First and foremost, we had the team from the Health Service Commission who came here and validated our staff. There were staffs who were validated and taken in, although there were others who fell off because of one reason or the other. Either they didn't have practicing licenses or they opted to remain in the district. Now, from then up to now, the government of Uganda, the Ministry of Finance, Public Service, and Health Service Commission interviewed more staff, and we got more staff, so that as we speak now, we have consultants, associate consultants, we have more medical officers, we have nurses and midwives, and these people are offering services in the different disciplines. We continue to offer the best for the patients we see in our hospital. As we speak now, we have now operationalized the private wing, which was not operational last year. We have also got the opportunity now to have this facility as an internship training center. We have now got interns who have come here to do internship in medicine, those who have come to do internship in nursing, those who have come to do internship in midwifery, as well as in pharmacy. We continue to supervise the health facilities in our catchment area. That is the general hospitals, the health center 4s, and health center 3s. We do support supervision, we do mentorship, as well as training. And when we get a facility which is not doing well, as per the reports, for example, if there are maternal death, there are infant death, the team from the regional referral hospital go to these facilities to investigate and also mentor those at those lower levels. We have also now formed the Yumbe maternity system, where we have a weekly meeting to review what takes place in our catchment area. The referral systems have improved. The phones and the we place phones in the wards. When a patient is being referred, information is sent prior to that, and by the time the patient reaches us in the hospital, we are really ready to handle that patient. We also have challenges. First and foremost, we thank the government of Uganda, that is the Ministry of Health, the Ministry of Public Service, the Ministry of Finance Planning and Economic Development, the Health Service Commission, for so far the staffs they have recruited for us, because this has already reduced on the workload. The over 75 staff who have been recruited to treat the patients for us are doing a great deal. However, we still have challenges when you come to this hospital. We have challenges in some of the departments which are not yet functional. For example, the mental health, we still don't have a unit. The ENT is not yet there. The blood bank, the advanced imaging center are not yet in place. So these departments also need to be constructed. We still have a challenge of human resource. Although we have got consultants and associate consultants, we still need more. We still need more doctors, we still need more nurses, more midwives, as well as the other cadres. In the area of funding, we also need more funds. The funds we are getting are not yet enough. As a new regional referral hospital, we need a little bit more. Being a baby, we need a little bit more compared to the other established health facilities. Yumbe, being the farthest regional referral hospital from Kampala, needs a little bit more funding. We also have a challenge of land. The land we are sitting on as a regional referral hospital is the same land area of a general hospital. The other day we had the UPDF brigade, when they came to construct for us the oxygen plant, we really struggled to find a space where to fit it in. So we need to be supported, and more land needs to be bought for this facility. We also need more equipment. We need more challenge of power. Our power goes on and off, and when we use the generator, it's very costly for us. We also need other support in the area of equipment, medicines, and the like. There are patients who are willing to pay and want to get specialized services quickly. We have introduced the private wing, where people can pay a little bit for the services they need. So this is run on a business model. Some bit of money and you get the services you want. So patients who can pay, please do come and you'll get the services. We'll have the consultant, we'll have the care you will need. We have the general services where you get general purpose services, as well as the other grades. We have rooms, and the rooms also have different grades. There is the platinum, there is the gold and silver. Thank you very much.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Good evening, viewers. You are most welcome for this DOCtalk show on this Thursday. My name is Mukama Hamza. I'm a doctor here at Yumbe Regional Referral Hospital, and I'm going to moderate this session. To my right is Sister Storia, who is a nursing officer working in NICU, that is the Neonatal Intensive Care Unit, and Dr. Mbaraka. You are most welcome for the show. Dr. Mbaraka is a consultant pediatrician and is the head clinical services at Yumbe Regional Referral Hospital. You are most welcome.
Thank you, moderator.
Yeah, you take this opportunity to introduce yourselves. Shall begin with Sister.
Yes, thank you, Mr. Moderator, Dr. Hamza. I am called Nyeta Storia, Assistant Nursing Officer Midwifery, working at Yumbe Regional Referral Hospital, attached to Neonatal Intensive Care Unit, the so-called NICU. Thank you.
Thank you, Sister.
Thank you very much, Dr. Hamza, our moderator. As I said, I'm Dr. Mubarak Nasur. I'm a consultant pediatrician working at Yumbe Regional Referral Hospital. I double as the head of department, pediatric and child health, and I'm also clinical head, Yumbe Regional Referral Hospital. Thank you very much.
Yeah, thank you so much, Doctor and Sister, for that introduction. So this evening, we shall be discussing about birth asphyxia. So we shall begin with Dr. Mbaraka. So Dr. Mbaraka, what is this birth asphyxia? How would someone, a lay person, understand this term birth asphyxia?
Thank you very much, our moderator. Birth asphyxia, sometimes it is described by people who come to our facilities as babies who are tired. And sometimes as health workers, we use it in the descriptive terms. But as we know that all babies, as they are born, they're supposed to breathe spontaneously or cry immediately after birth. And if a baby, by any circumstance, fails to cry or breathe on its own, then we say the baby has got a birth asphyxia or is a tired baby. And the condition usually results from a number of conditions, but this can occur either during labor, at birth, or immediately after birth. And babies who fail to breathe, it means there will be compromise or inability for the body to supply enough oxygen to the brain. Because there are a number of organs that are affected, but the ones that we fear most is the brain, followed by the kidneys. Any other organ can be involved, even intestines. If you do not get, then those organs would be damaged. We normally fear about the brain because once that damage happens, it might result into irreversible damage of this brain, and therefore results into longer-term effects that we will see as we move on.
Yeah, thank you so much, Dr. Mbaraka, for that insight. So a viewer who is out there would want to know, how big is this problem of birth asphyxia? Is it a very big problem in our country, and also maybe Yumbe Regional Referral at large?
Thank you very much. Birth asphyxia is a very common condition. As we know, every day in our country and in this world, there are babies who are being delivered. And because there are babies who are delivered, there will be automatically some of those babies who might be at risk of getting this problem of birth asphyxia. It happens from the statistics that we've had. If we take, for example, Yumbe Regional Referral Hospital, over 15 to 20% of our admissions in our NICU admissions due to that problem of birth asphyxia. We've also seen statistics because we normally have the local maternity and newborn systems where at regional level and national level, these statistics are presented. And the information that appears shows that this problem is very common. And it is one of the leading causes of admissions in our facilities. So it is a very common occurrence. And therefore, we very much want to bring this to the notice of everybody. And to mothers, we tell you a normal pregnancy does not guarantee a good outcome. Anything can happen, as I said, that the problem can occur during labor, during at birth, during the time when the baby is coming out, or immediately after birth. Yes, so it is a very common disease.
Yeah, so as we have heard, birth asphyxia is something that is occurring and it's affecting our babies. Maybe a viewer out there may want to know, why are we talking about birth asphyxia right now?
Thank you very much. I want to thank Ministry and UBC for having brought this program to us in Yumbe Regional Referral Hospital. As you know, this is our safe birth month. That is the period that the ministry, all stakeholders, we advocate together with our partners that support health, come together to really drum and tell the community that this problem exists. And therefore, we need to talk about it. Secondly, we want to also use this opportunity to highlight the magnitude of this problem. And we know for us to address this problem of birth asphyxia, the solution may not only come from within the health facility. We need the community to be part and parcel, because as you know, sometimes the delays in seeking health care that might result in some of these can be the delay when somebody delays seeking health care. Some delays might happen during the, at the health facility, when sometimes the supplies are not available, or during the transportation. These all occur. So we want to highlight some of these problems in order to highlight the magnitude, to drum up and ensure that every mother that comes in a health facility gets a safe and a safe delivery, so that the mother and the baby get a good outcome and leave our facilities very happy. We also use this opportunity to together mobilize policy makers, the community people, as I said, in order for us to reduce the burden of this condition. If we can really work on some of the other contributing factors that I mentioned about, or the problems that result in this condition, we can all together reduce this burden of these babies who are born very tired.
Okay. Yeah, thank you so much, Dr. Mbarak, for introducing to us what birth asphyxia is, or omwana okukowa. So, sister, we would like you to explain to us or tell us what are some of the risk factors. What causes these babies to get tired? What causes this birth asphyxia?
Yes, thank you, Mr. Moderator, Dr. Hamza. As earlier on, Doctor had talked about them being grouped into 3: before delivery, during delivery, and shortly after delivery. So what can dispose the baby to getting tired when it is still in the womb? It could be the tight cord around the neck. Yeah, some babies are born with a very long loop of the umbilical cord, that it can even tie around the neck like 3 times, and it can tighten, reduce the supply of blood to the baby, and shortly, in case you are delivering this baby or in the process of delivery, can be already tired. Then there is this issue of maternal illness. Some mothers can be having diseases as they labor, as they go on with their pregnancy. Since we are talking before pregnancy, maybe she has high blood pressure, or maybe she has diabetes. That one, since the mother and the baby are inseparable, the baby is depending on the mother when it is in the womb. So in case a mother is not in a good shape, the baby also gets the problem. Then it could be maternal infection. Yeah, the infections are many. We can have malaria, we can have syphilis, we can have HIV, we can have hepatitis, just to mention. So since there is the mother and the baby is part of the mother, the baby can end up getting such risk along the way. Then I can also go to the ones during delivery.
Sister, hold on. Before we go for those other important risk factors that can happen during labor, we are first going to go for a short commercial break.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying, and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.
Looking for instant excitement? The Uganda National Lottery Spin for Cash game is now available online. Wherever you are, you can join the excitement for just 500, 1,000 and 2,000 Uganda shillings. Don't miss out. Register now on www.nationallottery.go.ug for a chance to win your share of 2 billion instantly. What are you waiting for? Play Spin for Cash now, anytime, anywhere. Ituba is the proud operator of the Uganda National Lottery.
Uganda National Lottery. Dream, play, win.
Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back. This is the DOCtalk show here at UBC TV, brought to you by Ministry of Health with support by the government of Uganda. Before we went for the break, we were still talking about the risk factors or the causes of birth asphyxia, what makes a baby to get tired. So sister had explained about factors that can occur before delivery, and she was starting the factors that can occur during delivery. So Sister Storia, what are some of those risk factors or causes that can occur during labor or during delivery?
Yeah, thank you, moderator, Dr. Hamza. Yes, as we had concluded with risk factors that occurred before delivery, we are coming with the ones which can occur during labor and delivery. One can be a big baby. So if the mother in the process of labor is having a big baby, as the baby tries to negotiate the process of delivery, it can go through, it goes through the bones, of course. So if it is bigger than the canal where the baby is passing, it can expose it to that tiredness that we are talking about, which is called birth asphyxia. There could be also abnormal positioning. So the normal position is when the baby presents the head, at least the back of the head. But there are those babies who can lie transversely or across the mother's abdomen. There are those babies who can bring the leg. There are babies who can bring the arms or who can present with the shoulder. So as they also, the way we talked about labors which are not monitored, maybe in that process, this is the mother who is struggling to deliver from home or who wants to come late in the hospital. A such mother who goes through labor with in such condition, the baby can be exposed to that kind of tiredness, even if it's to come and be helped. So there could be also little water. They call it amniotic fluid in our term. That is the water in the womb that the baby prays in. This water can be reduced or it can be too much. So if it is reduced, it means the baby's activity to move in the abdomen, in the womb, it reduces. And if it reduces, it means the baby is also exposed to that tiredness because his activities are encroached on and he doesn't or she doesn't move well. So in that process of maybe labor going on, delivery going on, you find that that one has already distressed the baby. So it could be maybe a wrong process, a pregnancy that has taken long beyond 9 months. So these kind of babies, for the placenta to feed the baby well, it has a limited time. But there are those babies when the time for delivery or time for being born reaches, you find they are silent, the labor does not start. And if the labor has not started, and this baby has continuously remained in the abdomen, shortly the placenta will not provide what it is supposed to give this baby. And if it is reduced, it means the risk goes back to the baby. And a baby, yes, we can get this baby tired, or shortly you find even it dies when it is still in the womb. Then there is this complication of prematurity. Yes, we have said that for the baby to be able to be delivered, where the baby qualifies to come out of the womb, it is when it makes 37 complete weeks to 40. But there are those babies who come out before that period. So those ones get the complication of prematurity, and because they were not able, they were not yet supported enough by the womb to come out, then in the process of being delivered, they can, yes, be active shortly, then deteriorate, which is actually what we are talking about, birth asphyxia. So it can be also labor that is not monitored. Yes, there are these mothers that they can even come to wait in the hospital, but when labor starts, they keep quiet. They want to go to be seen by health worker when they feel they are about to deliver. They don't want to go through that process. But along the way, when the labor has not been monitored and there was a problem before, it will not be discovered. And by the time the nurses, the person who is responsible gets it, the baby is already tired. So however much this baby can be helped in any other method, can be done cesarean section, but that condition comes in. Yeah, that is during delivery and labor. Then we have those ones which can come in shortly after birth. So those ones that can come in shortly after birth could be a baby with abnormalities. There are those anomalies that can be seen physically, and there are those ones that they are internally not seen. So the ones that they cannot be seen, like the heart problem, there can be a hole in the heart. But you deliver the baby cries very well, you're happy with the mother, shortly the baby changes condition. And it is because of that heart problem that you were unable to see in that process of delivery. It is not exposed to you. But there are those babies who also have external problems that you can see. There are these babies that are delivered and you find the abdomen has not covered the internal organs. You find the baby is delivered, but the intestines are out. Or there is just a seal on the intestines, or the seal is even broken. So this baby will come out alive, but because of what it is exposed to, shortly you find it deteriorates. And that one takes us to that birth asphyxia. Of course, in addition to the congenital abnormality. It could be also maybe because there was delay in assisting this mother. Yes, some mothers, the way we have talked, some of them think that they can deliver from home, especially if she has been doing it and all has been going well. She can choose to say, I have been delivering from home, why should I go to the hospital? So like if that mother was exposed to any risk, it means even if she comes to the hospital because she has given up on what she was doing, either she reaches us when the baby is tired, or when the baby has even already died, or herself can die because she has struggled. The reason why she's coming, it's because she has given up. Or it could be because the equipment we are supposed to use on helping these babies are not there, or if they are there, they are not functional. So if they are not functional, still you may not do much, because if the baby is in that state of being tired, you're supposed to do it very fast. Within the first minute, you're supposed to have known that, yes, my baby is born but has a problem. Then you intervene with those instruments or equipment which are supposed to be set ready. But if you are not ready, it means you will find you are really taken by surprise, and this baby can be exposed to the condition we have talked about, being birth asphyxia or delivering a tired baby. Thank you very much, moderator.
Thank you so much, Sister Storia, for taking us through those different risk factors. As to the viewers, you have already seen that you have to go for antenatal, you have to deliver from the hospital, and you have to make sure that your baby is monitored after delivery. Dr. Mubarak, we would like you to tell the viewers what are some of the symptoms or signs. How will a patient, how will maybe a mother, how will a father or a caretaker know that maybe this baby may have symptoms or this baby is so tired? What are some of those things that we look out for?
Thank you very much, our moderator. Maybe before I answer that, I want to really underscore the need for working. You see, sister is a midwife, but is working in our newborn care unit, and therefore pediatricians, nurses, and the obstetricians working together is very key in seeing some of these results. For example, she has talked of the risk factor like prematurity that will require a pediatrician to support, or a neonatologist. She has also talked about some of the other conditions like a big baby that may also require attention of the what? Of the obstetrician and the pediatrician. Those risk factors, we work together, and that's why in our niche in the Yumbe regional referral, we've had a cadre mix of both nurses and midwives, and that adds to the blending of the experience that we've had. So the babies that we talk about that come out tired, how will somebody know? In most cases, these babies will fail to breathe spontaneously, or they will not cry after delivery, because we know that as soon as babies are produced, they will be able to cry, and that normally puts a joy in the face of the mother. If that does not happen, you will also see a baby who is unable to cry. The baby will also be not active, because babies who are born and are okay, you'll find they will be able to move all the hands and the other legs. The other thing we normally see, some of them may present with color changes. You find a baby, as soon as a baby is born, the baby's color is usually pink because of those changes if it begins inhaling or taking in air. But you will find the extremities of this baby will remain blue. It may also change and come to the other. There are those who will come and will have that difficulty in breathing. You find they breathe more faster than the normal, the normal rate for that child, for that age group. That also becomes. There are also those, in most cases, people normally say convulsion. You see abnormal movements. And therefore, those are some of the other things that you will be able to see. And you know, by the time a child convulses, like I earlier on told you, the problem can be damage to the brain. Also, the other organs get damaged. But convulsion is mainly when there is damage to the brain.
Thank you so much. So to the mothers out there, to the caretakers, and to the health workers, after giving birth to the baby, let's look out for these signs and possibly intervene immediately. We shall end here for this second session of this DOCtalk show here at Yumbe Regional Referral. Keep it at UBC TV.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk show here at UBC TV, brought to you by Ministry of Health with support from the government of Uganda. We are here at Yumbe Regional Referral. My name is Mukama Hamza. I'm here with Sister Storia and Dr. Mubarak, the consultant pediatrician. So they are taking us through about the signs or what you look out for in babies who have birth asphyxia. So from there, Dr. Mubarak, should these mothers worry about this birth asphyxia when the baby is tired? Should there be a worry in the family?
Thank you very much, our moderator. I think the answer is yes. But this should only not be mothers. It should be mothers, the fathers, the caregivers, and us as health workers. Because as we realized, if we do not then get concerned and worried, and we get some of these other babies with the birth asphyxia, then the consequences are usually very severe. Okay. And we don't want anybody to go into those. Just like as earlier, as we started this talk show, I had earlier also hinted that having a normal pregnancy and labor does not guarantee a normal outcome. Okay. And you've seen the phases that our sister Storia went through, that these babies can get a problem either during labor, during pregnancy. The problem can also occur during the delivery, but also after. Okay. So at all times as health workers and as mothers, please do not just assume that I had my first pregnancy, it was normal, all is going to be normal. Okay. But also, it should not be, you should not only listen to people that so and so has had a pregnancy and is the one my advisor. No. Every pregnancy must be treated differently. Okay. And therefore, we want everybody to come to health facility to be supported.
Thank you for watching the DOCtalk show. You can follow our social media platforms. They are live there on the screen. And if you have any questions, you can send it on the number that you are seeing on your screen. Doctor, just in case a baby is born and is having birth asphyxia or this baby is tired, is there some treatment that can be offered or any support that can be given to this baby?
Thank you very much. I think there are treatments available in most of our health center, FOS, the general hospitals and the referral hospitals upwards. Okay. And we know that in this country, majority of our mothers normally go to deliver from the facilities near them. Okay. And those facilities that are near majority are health center 3s. Okay. And we encourage that in a case any mother is identified and has any of those risk factors, should be referred early to the next level. Because as you move higher from health center 3 to 4, 5, the academics, the people who are a little more qualified, when you come to a general hospital specialist, you will find them there, and even the regional referrals. So we ask you to really take advantage. When you are advised as a mother, please don't refuse to come and move to that level. But to me, and I think as health workers, we normally say prevention is better than cure. We should all work towards preventing and not waiting for the problem to occur and then you treat. But as we know that, as I said, some of these babies, when they fail to cry or breathe on their own, as soon as they are delivered, there are processes that we do. We normally support them to breathe. And sometimes we use some special equipment to pump some air into the lungs so that they start spontaneously breathing. There are mothers who normally fear, say, I don't put these things on my baby, but these are all done. There's nobody as a health worker trained who is there trained to kill. We are there to save lives. And therefore, as health workers, I also request you to continuously in the process of giving health care, talk to our mothers so that they get to know that this health work is doing this intervention to help my baby. But if you do it on your own, so every step that you will be doing and any support you are giving, please involve the caretaker and also support the mother. There are those, after resuscitating them, we might require giving them oxygen. We put them on oxygen. Many people normally fear. There are also those who might suffer from, like Sister Storia said, some of the other causes that might occur is the baby's hand comes out. And during the process of manipulating, the baby might get injured. And therefore, they may require treatment for those injuries. There are those who develop the convulsions I talked to you about earlier as some of the complications. They may need treatment, and we have some of these medicines available in the places where we work. There are those initially, as you know, that all our babies, when they are delivered, we want them to begin suckling or breastfeeding within 1 hour. But a baby who has been born tired may have inabilities to suckle because they are either weak, they are unable to suckle, and therefore we introduce a tube that we insert sometimes either through the mouth or the nose into the stomach, so that we ask the mother to express that breast and then feed that baby, because the baby will still need feeding, and therefore we support their feeding. And later in life, there are those who might get the irreversible damages that we talked about. In most cases, you might find them as they grow, they're a little more stiff. There are those who become very weak, they can't even sit with the support. They might require some bit of exercises, what we call physiotherapy. And this, the earlier we start it, the better for us. So prevention, prevention, prevention is one way to do it. And we can only do prevention, we can only achieve better outcomes if we really work with our mothers. Please, mothers, we are here for you. Please come. We shall be able to support you. There is no health worker who is trained to kill. We are trained to support. And we cannot be the only people to live in this profession for long. And that's why we support those who will come and take over from us. And that would require us saving as many lives as possible. Thank you very much, moderator.
Thank you, Dr. Mbarak, for that submission about birth asphyxia, as why we should worry about the condition and also the treatment that we can get. Maybe someone out there would like to know, are there some long life challenges these babies can face, or the family is most likely to have when a baby has been born, when they are tired or they did not cry immediately?
Thank you very much, moderator. And as earlier on said, that when a baby is tired, a number of, it means that baby might be deprived of oxygen to the brain. This might also happen to damage the other organs. The kidney is the other organ that's normally damaged, and any other organ can be damaged. But the one we fear most about is maybe the brain. And once the brain is damaged, I told you, if you take more than maybe 2-3 minutes without intervening, in fact 1 minute after without intervening, that's why we normally talk about our golden minute as health workers. That is the first period. If you notice a baby who is not crying, you should intervene. And some of the other things are the ones that I earlier mentioned. But just in case it happens, most of these normally result into irreversible brain damage. Some of these irreversible brain damage we might see at the end of, as the baby grows, I told you they become very stiff. They get what we call cerebral palsy, or they become too soft. And some of them develop, they may start with what we call convulsion that I told you we can treat. But this might end up getting what? Epilepsy. Then the other thing is some of them get what we call learning difficulties when they go to school, because they are unable to grasp. Some of them may have challenges with talking or speaking, and therefore language impairment, movement, because when you become stiff, you may be unable to move properly. I told you feeding problems might also happen because they are being able to suckle, and even as they grow, that might also result into coordinating swallowing might be a problem. The other thing that you might also result is death, and we don't want it to happen. And therefore, we should be able to look out for those, and sometimes they require a lot of interventions, a multidisciplinary team. Sometimes they are costly. My advice is, let's try as much as possible to prevent. Prevent, prevent, prevent. Deliver in a skill, be delivered by skilled health worker and seek healthcare early, so that you are supported.
Yeah, thank you so much, Dr. Mbarak, for that submission and those different challenges. As you have heard, it is very costly to raise up a baby who has got to the extreme conditions, as you have said, epilepsy, cerebral palsy, children with learning abilities. So let's stick to preventing these conditions before they happen. Thank you for keeping it to UBC TV. This is the DOCtalk show, going for a short commercial break.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. We are still on the DOCtalk show here at UBC TV, brought to you by Ministry of Health with support from the government of Uganda. For those who are just tuning in, we are still talking about birth asphyxia, or the baby getting tired. We have looked at what makes a baby get tired, how would you manage a baby who has got tired, what causes or what brings about the baby getting tired or being associated. And we have looked at the management, and from that what we have picked, and also I want you to know, is that prevention of this condition is very key than managing it. And you have seen on the streets of maybe town Kampala, babies who are left on the ground, who are crawling. Most of these are like aftermath of conditions like birth asphyxia. Straight away, we shall go to talk about prevention. So, Sister and Dr. Mbarak, I would like to welcome you for this session. We would like to know, how can this condition, birth asphyxia, how can it be prevented? And what are we doing as Yumbe Regional Referral to prevent such from happening?
Okay, thank you very much, moderator. As we go to the prevention, we have many things that we are supposed to do to prevent birth asphyxia. Okay. But there are few that I'm going to highlight. There is attendance of antenatal, early attendance of antenatal. Why do mothers attend antenatal, especially early attendance? It is because we are interested in determining what the baby is going through around that time. And that is the time the baby is forming. And that is why we go ahead and encourage, at least the earlier the better. If you get to know that you have missed your periods, okay, yes, it means you're pregnant. Or even if you're not sure, go to a health worker and test to confirm that you're pregnant. Okay. And if you're pregnant, that is already the right time to start. And in so doing, that time, that is when they will screen you to find out any risk that you as a mother you have. Okay. Especially like if you have malaria, they will take the malaria test. If you have syphilis, they will know. If you have HIV, they will know. If you have hepatitis, that is the time they will discover. And if you have blood group issues, that is the time they will discover. And if they have discovered as early as that, it means they will journey with you where during your pregnancy, the journey of your pregnancy. So that is why we do early attendance, and we tell our mothers, please, as soon as you get to know that you're pregnant, come and confirm your pregnancy. Okay. And that one takes us, like from the time you have detected up to 12 weeks, okay, we confirm the first visit. Then we identify and treat all maternal illnesses during pregnancy. So as I have already talked about those other risks, the HIV, the malaria, yes, we have discovered them. So what shall we do for them? Okay. It means this mother will get a chance of being treated and of being told that, yes, these are your risks. Please don't fall back. Continue attending antenatal for the betterment of your life and for the betterment of your baby. Okay. And that one will help. So those maternal illnesses that we treat, these are the mothers, sometimes you find even they have blood pressures, they are not aware. Okay. You find the mother has diabetes, she's not aware. And this is the time we discover when you come for antenatal. Okay. Then we encourage 3 antenatal scans. Okay. You're supposed to do scans in all the 3 trimesters, where we have said there is a first one, second, and the third. Okay. So in the first one, which we have said it ends as early as 12 weeks, okay, we are ruling out the abnormality which the baby can be having. Okay. This scan will be able to see it. And there are those mothers who only come, they feel those signs, maybe I'm pregnant, they are not aware. Okay. And that is the time when that scan is done. It can at least give you the estimated time the mother is likely to deliver when you do it around that time. Then in the second visit, why we encourage a scan, yes, this baby is already forming and everything must be already formed. So if this is the baby who is normally formed, the scan is able to see. And if there is anything deviating from normal, even the scan will give the results. And that is when they prepare the mother. Yes, you are going to deliver the baby, but your baby may not look normal the way you expect. And the mother also prepares to know, yes, I'm going to deliver, but my baby may not be the best, may not be normal. So not to be taken by surprise at birth. Then in the third trimester, that is when we are finding out, is the baby ready for delivery? How is the position of the placenta? So if the placenta is in a wrong place or is in a right place, which mode of delivery are we now communicating, are we preferring? So meaning that one also helps us to know the mode of delivery of the mother. So there are these mothers who fail to come to the hospital because they feel they can do it at home as usual. So we encourage them not to deliver from home. Please, those services are in the hospital. Don't say I've been doing well, I've been delivering my babies, it will always be the same. So that is why those services are there, and that is why we encourage mothers to always attend and be delivered by skilled health workers. Thank you very much, Mr. Moderator.
Thank you so much, Sister Storia, for taking us how birth asphyxia can be prevented, as we shall keep on recalling prevention is better than cure. You can still follow the program on our social media platforms, that is X, Facebook, and YouTube. And you have to let you know that all these preventive services are still offered at Yumbe Regional Referral Hospital, plus our facilities that we supervise. Dr. Mbarak, do you have an addition, especially on prevention, or an addition about the topic of interest we are discussing?
Thank you very much, our moderator. I think the only addition I want to add, in addition to ensuring that people deliver in the health facility, is referral should be swift. We have opportunities like the local maternity and newborn systems. And for us, we have ours called the Yumbe local maternity and newborn systems. That is a platform which we are using to support referrals, so that we get better outcomes of the mothers and the babies. Let's utilize that opportunity and so that we're able to do it. The other thing maybe to the moderator, our facility is here. We are here. Please let the people come. We are ready to serve them. If we can be woken up at 2 to support other people, that means Yumbe is ready. And we have saved many people here. As you know, our newborn survivors improved. We've been able to support. We have formed these newborn resuscitation committees, and these are all to our clients. Please, the facility is ours. Let's come and get the needed support. Let's come early to attend antenatal. For Yumbe and us as health workers, we will always strive to ensure that the ministry gets the best. So thank you very much. And as I said, our facility is open. Please let people come so that they get the needed support.
Okay. Thank you so much, Dr. Mbaraka. Dr. Mbaraka is a consultant pediatrician at Yumbe Regional Referral. So you have to take whatever he says very seriously. So, Sister Storia, do you have any closing remarks, any advice you would give to a mother planning to become pregnant, or someone who is already pregnant, and those who have just given birth? How maybe any take-home message about this birth asphyxia?
Okay, thank you very much, moderator. My take-home is all about shift referrals, especially to our small facilities down there. They should not battle with conditions when the regional referral is open, and those platforms have been put so that they communicate their problem before. so that at least any mother that is coming or a baby, we are ready to receive the baby when we know the condition, and we are ready to guide as the management goes on, even when the mother is still in a raw facility. Then another one, we encourage early antenatal. Please, mothers, we are there. Those services are really available. Please don't wait to start coming when you're in labor, when you're saying, I was not sure, or when you don't have an antenatal card. It is taken as a surprise, a mother to come in labor without antenatal card. So it is a very funny thing. So that is why we are telling them these services are given as early as below 3 months. So as long as you get to know that you're pregnant or you suspect, come. The services are ready, and that is how they begin. Thank you very much.
Dr. Mbarak.
Thank you very much. I only want to say we have said it all, our moderator. As